there was a powerful line in the case where you guys said, we still don't know what really defines quality in hospice. How do you think business schools and leaders should approach managing something that maybe does not easily get to traditional measurement? That really applies that it's hard on our side because ultimately, if you've done a great job, we call it the good death. Well, what does that mean? Now they do reality TV shows around stuff like this. And that was a story that we told. And I think in that case, it was a good death for a dad and a son because they got reunited. We did good symptom pain management. But how do you measure? How do you put a measure on that? So I'm curious what you guys, and have you seen this in other industries where it's hard to measure? Are you providing a good quality product?
I love this question because it is so central to my research on impact measurement in a different context, in impact investing or in mission focused finance. The right response is not to give up on measurement, but to be honest about what it can and it can't give you. But they measure these grief adjacent experiences that are almost impossible to generalize. So there are some proxies that we discuss in the case. So referral rates, staff retention, volunteer hours. These are proxies worth tracking. But one of the core findings of my research in impact investing is that when measurement is genuinely hard, when what you are trying to measure is something like social change through finance, so like educational attainment or economic improvement, it's not that organizations abandon measurement, but that they use it for something different than its stated purpose.
I think some regulatory framework and some rethinking of our society, kind of how we want this care to look, feel, and be, especially in the age of AI.
Totally agreed. I came away from this wonderful experience learning about your industry, learning about your organization. I walked away believing that how we treat dying people is one of the most honest measures of what a society really values. Not what it says it values, but what it's really willing to pay for, and how normalized this erosion of values can look in an industry.
I think you talked about your model lets you have influence but not authority, which is a natural tension for you. There may be times you want to really impose and say you really should do this, you should do that, but you can't. You can only suggest and influence. I think the evidence is that your model's working.
So as Steve was saying, you look back at the founding of hospice, these incredible women who founded a whole industry through a process really of moral imagination. Imagine that there's a better way